Every day, millions of people drink what looks like clean water, but hidden inside could be a deadly parasite. It starts quietly in the intestines, and for some, it ends up with life-threatening liver damage. This is amoebiasis, the silent parasite that thrives where hygiene fails. Hi everyone, welcome back to my channel. I'm MamlieO, and today we are diving deep into one of the most overlooked yet dangerous infections, amoebiasis, caused by Entamoeba histolytica. In this video, I'll take you through how the parasite spreads from contaminated food and water to the liver, how to recognize the symptoms early, and most importantly, how to prevent it through simple hygiene and sanitation practices. So if you care about your health, your family, and your patients, stay tuned, because understanding this infection could literally save a life. Amoebiasis is caused by Entamoeba histolytica and is a global health concern. It is a protozoan infection of the intestine and is spread via fecal-oral route. It is endemic in tropical and subtropical regions, and the major link is poor sanitation and hygiene. The life cycle involves ingestion of cysts from contaminated food and water. This is called the cyst stage. This is the infective stage. Then the ingestion takes place. The human consumes contaminated food or water, leading to excision in intestines. Excision in the intestine is the process where the protective dormant cyst form transforms into the active motile trophozoite form. This process is a critical part of the amoeba's life cycle and occurs after a person ingests the cysts through eating contaminated food with fecal matter. These are hardy, mature cysts. Their resistant outer wall allows them to survive the acidic environment of the stomach. During this stage, the cysts travel to the small intestines, specifically the terminal ileum. Excision is then triggered by the change in environment, especially the more alkaline condition and the presence of intestinal enzymes like trypsin and the bile salts. Then there is the release of trophocytes, where the cyst walls break open and the amoeba emerges. Initially, a quadrinucleated metacyst is formed, which then quickly divides into 8 small single-nucleated motile trophocytes. Colonization and manipulation then occurs. These newly released trophocytes migrate to the large intestines, called the colon, where they feed on bacteria and host cells, multiply by binary fission, and colonize the gut. It is important to note that trophocytes are the stage responsible for causing symptoms of amoebiasis, like diarrhea and abdominal pain. If they invade the intestinal lining, some trophocytes insist again to form new cysts, which are then passed in feces, continuing transmission cycle. Clinical features are in 3 categories. The asymptomatic carriers, these are the most common. Intestinal amoebiasis, where one presents with abdominal pain, diarrhea, dysentery, and there may be blood and mucus in the stool. In the extra-intestinal, patient may present with amoebic liver abscess, fever, and tender hepatomegaly. Hepatomegaly means the liver is enlarged and painful. There may be lung and brain involvement, but this is rare. Diagnosis is usually through stool microscopy, where cysts and trophocytes are isolated. Antigen detection by ELISA and PCR. And imaging, where ultrasound or CT scan for the liver abscess is done. Treatment involves use of metronidazole or tinidazole for trophocytes. Luminal agents to clear cysts and rehydration and nutrition support are recommended. Drainage of large liver abscesses may be required. Prevention is basically by use of safe water through boiling and filtering, hand hygiene and sanitation, washing of fruits and vegetables well. And above all, health education in communities is key. Clean water, clean hands, healthy communities. We've come to the end of this part 1. Stay put for part 2, where we will discuss what happens when amoebiasis spreads from water to the liver in more detail. Always remember that amoebiasis may start as a simple stomach ache, but if ignored, it can become a serious and even life-threatening infection. Remember, prevention begins with clean water, clean hands, proper sanitation. These small steps can save the entire community from suffering. If you found this video helpful, please give it thumbs up and share it to spread awareness. Don't forget to subscribe to my channel, MamlieO, for more health and education videos that empower you to protect yourself and others. Because in this nursing profession and in life, you either earn your blessings or curses. The decision is yours. Stay safe, stay informed, and I'll see you in the next one. Thanks for watching. Remember, this channel is for information purposes only and not diagnostic. Remember to consult your nearest health service if you experience any of these symptoms. Goodbye.